If you don't mind, can I get the spelling of your name, please? Okay, just look directly at me, please. Thank you. So let me just check your scan here. Heart rate's normal, blood pressure's normal. Okay, so I'm not seeing any contraindications that we can't proceed right now, so I'm going to move forward. Patient 42, the doctor is ready to see you now. Please make your way over to room 3. Thank you. Oh, hello. Please, come on in. Yes, take a seat right there in front of me. Thank you. How are you doing today? Good, I'm glad to hear. I'm doing well. Thank you for asking. My name's Dr. Gabrielle. I'm going to be your practitioner today, okay? All right. Well, before we get started, I just have to go out and fill a customer patient form if that's okay. Yeah, I just need to capture a little bit of information before we get started. Thank you. All right. If you don't mind, can I get the spelling of your name, please? Perfect. And can I get your date of birth? Perfect, thank you. Do you have any known allergies? Okay. And what are they? Okay. And what species are you? Right, thank you. And have you experienced any recent changes in your health or any medical conditions? Okay. Are you currently taking any medication or supplements? What are they? Thank you. Have you undergone any recent surgeries or medical procedures? Do you have a history of chronic illnesses or medical conditions? Okay, and can you elaborate on that? Okay. Thank you. And what is the reason for your visit today? Okay. Yeah, that's no problem. Okay, and is there any additional information about your medical history that you think is important to let me know? All right, perfect, thank you. Okay, so you're here today for an X-chip installation. Excellent, yep, that's no problem. So before we begin, I'll describe the implantation process, and then you'll get to select which one that you'd like to have installed. If you have any questions, please don't hesitate to ask, okay? Thank you. So, the process begins with a cerebral scan of the patient's neural pathways, mapping the network of synapses that form their identity. We will numb the surgery area and give you a NeuroCalm injection before performing the installation. The X-chip is implemented at the base of the patient's neck, and the chip will link with the neural interface of the brain, forming a symbiotic bond that bridges the gap between human consciousness and technological innovation. Okay. So what is the science behind X-chip? At its core lies a revolutionary blend of quantum encryption and biometric authentication algorithms. These algorithms encode the individual's identity information, their galactic passport, medical records, and financial data into a matrix of binary code securely stored within the confines of the chip. So the X-chip serves as the primary identification tool recognized across the universe. It is not merely a convenience, but a necessity mandated by the intergalactic peace governance. So these are the 3 following upgrades we have available. First, there's the enhanced health monitoring. Equipped with advanced biosensors capable of continuously monitoring the wearer's vital signs and psychological parameters. From detecting early signs of illness to providing real-time health insights, these chips revolutionize personal health care. Then we also have the personalized AI assistants. So powered by sophisticated artificial intelligence algorithms, select X-chips offer personalized virtual assistants that anticipate the user's needs and preferences, whether scheduling appointments, managing finances, or providing tailored recommendations. these AI companions become indispensable allies in daily life. And then lastly, we have the emergency response. So in the event of an emergency, certain X-chips feature built-in distress beacons that automatically transmit the user's location and vital information to nearby authorities. For medical emergencies to secure threats, these chips provide peace of mind in times of crisis. Okay, so which of these additional features would you like to have programmed on your X-chip? Yep, the base fee for the procedure includes one of the three. However, you can add any additional for just a small fee. It's approximately 200 credits. You'd like to do all three? Excellent choice. So, before we begin with the implant, we must perform a cerebral scan. Using advanced neuroimaging techniques, the cerebral scan charts the intricate neural pathways of the patient's brain, providing a detailed blueprint essential for the precise calibration of the X-chip implant. Through a seamless integration of neural interface technology, the scan dynamically links with the individual's cognitive functions, delving into the depths of their thoughts, emotions, and subconscious processes. By tapping into the neural network, the scan not only maps the physical landscape of the brain, but also charts their consciousness, ensuring a successful synchronization between the patient's mind and the artificial intelligence of the X-chip. It is an essential step in the process as it allows us to calibrate your implant post-surgery. The scan will also allow us to track your heart rate and blood pressure during the implant surgery, as well as identify any possible complications or health concerns that may prevent us from moving forward today. Okay, all right. Do you have any questions before we move forward with the cerebral scan? No? All right, perfect. Yeah. Just sit back and relax. I'm just going to get my tool here. First, I'm just going to sanitize my hands. Okay, so we're going to move forward here with your cerebral scan. Okay, just look directly at me, please. Thank you. Look towards the right. And then look towards the left. Thank you. Back towards me. Oh, complete. Thank you. All right. So, with this, everything looks good. The initial diagnostic test does not show any signs or concerns for us to proceed, okay? Great news for us. All right. Before we move forward with the implant, I'm going to need to give you a NeuroCalm injection. So NeuroCalm is a revolutionary pain-numbing injection. It eradicates pain entirely, enabling patients to undergo even the most invasive procedures without the need for traditional anesthesia. It also induces a state of profound calmness, relaxation, and euphoria. Through a sophisticated blend of neurochemical modulation and targeted nerve desensitization, this injection ensures that patients remain fully alert and coherent throughout the procedure, enhancing communication between medical professionals and patients while eliminating the distressing sensation of pain. This innovation brings a new era of patient-centered care, where discomfort and anxiety are relics of the past, paving the way for a more humane and effective approach for medical treatment. Okay, do you have any questions or concerns before we move forward with the injection? No? Okay. All right, so I'm just going to go ahead and get my gloves on. No, we do it all here in this room. Yeah, I'm just going to go ahead in a moment here and spin your chair around so that I can access the nape of your neck, so that I can perform the procedure. All right, so here, your chair's just going to start spinning. Okay. All right, so first I'm going to go ahead and apply a little bit of a sanitization serum. This here will take away anything that we don't want in the area on the surface of your skin when we're doing the procedure, okay? I'm just going to move your hair away. All right. Okay. And also, before I go ahead and do the injection, I'm even going to put a little bit of surface level numbing cream so that you won't even feel the injection or the needle go into your skin, okay? Yeah, we're kind of doubling down on the numbness. Our main priority here is for you not to feel any discomfort, okay? All right. Okay, so I'm just going to go ahead now and apply a little bit of this numbing ointment to the surface of your skin. Okay. So that will be in the area of the injection site and the procedure. Just be a moment. Okay, so what I'm going to do is a quick test to see if you can feel anything. It works very, very quickly, so I doubt you will. So I'm going to go ahead and poke the neck here with a very, it's not very sharp at all. It wouldn't like break the skin or anything like that. So I'm just going to go here. Did you feel that? No? Okay. I'm going to go ahead and do it again. Did you feel that? No? Okay, perfect. So let me just check your scan here. Heart rate's normal, blood pressure's normal. Okay, so I'm not seeing any contraindications that we can't proceed right now, so I'm going to move forward. All right. Okay. So right now I'm about to approach with the injection needle. Okay, this will just be a moment. You won't even feel this. I'm just going to count down from 3. 1, 2, 3. Perfect. That's all done. The injection, that is. Okay. Just going to give it a couple of moments here. Just check your information. Yep. Everything seems fine. Okay. So, how are you feeling? Okay, good. Relaxed. Yeah, that's what we want to hear. That's totally normal. Yep, even a little happy, a little sleepy. That's okay. But you'll be fully coherent. You won't end up falling asleep. All right. Okay, just relax. Breathe. Perfect. Okay, so I'm going to move forward with the surgery, okay? All right. You won't feel anything at all. At most, you'll just hear some clicking sounds and stuff like that. But even still, in this current state, you won't feel distress whatsoever. So I'm just starting by making an incision in the skin. Okay, perfect. Okay. All right, so I've already gone ahead and made the incision. I'm just going to go ahead and place the chip inside, okay? All right. Perfect. All right, so the implant is perfectly placed. Yep. So lastly, all I have to do is go ahead and do a little micro suturing so that your wound closes. Yeah, no, by the time you leave here today, the numbing agent will already be worn off and the skin will already have started to heal. Yeah, it's part of the technology of the micro suturing. Very fast healing. No, it won't even leave a scar. All right. So, are you still doing all right? Okay, perfect. Okay. Right. Almost done. There we go. Perfect. Excellent. That's all complete. I'm going to go ahead and spin you back around, okay? All right. All right. How are you doing? Good. No, I told you wouldn't feel it at all. It's quite relaxing. All right. So before I let you go today, the last step is we just have to calibrate your chip, okay? All right. Okay. So lastly, I'm just going to go ahead and run a calibration test, okay? Just to make sure everything's linked up properly and that there's no concerns before I let you go for the day, okay? All right. So right here, I'm going to have a screen displayed for me so that I can go ahead and tap on the different points on your cerebral scan, and it will go ahead and sync up with your X chip. Okay? Nope, nothing needed from you. Just sit back, relax, and I'm just going to be doing some gentle tapping near your face. Okay. All right. Okay. Just a few more. Almost done. And that should be it. Perfect. So your installation was successful without any complications, and it's fully calibrated with your biochemistry. So your next step will be to meet back with me in 1 week, okay? Yeah, we'll have to have a follow-up appointment. So you'll be required to have all of your administration settings updated and information synced with your neural cloud. Okay? So do you have any questions before I let you go today? No? Okay, well, it was a pleasure meeting you. I hope you're doing well. All right. Well, take care of yourself, and I'll see you next week.